our community is not clean. And so when I think about environmental justice and I think about its impact on maternal health, I think about the fact that women and children who are in poverty, which are more likely to be African American, are suffering from less access to clean water, less access to healthy communities. They live in communities with factories, which is putting pollution in the air and toxins. They also don't have access to information and good quality food so that they can keep their bodies healthy. Poor communities and communities of color have less access to food. They're food deserts, meaning pregnant women are getting less access to healthy food. People are living in communities that are built on toxins, and there's being toxins in the air, which means these women are breathing in toxic air. We also understand that these are creating sources where the water isn't as clean, which means these women are drinking water that is not clean and healthy for their environment. So if we're able to tie how taking in less clean resources contributes to your ability to have a healthy body and contribute to a healthy pregnancy, we then can connect environmental justice and maternal health and really bring it to a real way where everyday people can understand the impact. And all of the low-income communities in Memphis where I live, they're around factories and very manufacturing plants. And I'm thinking about all these smoke and chemicals that's going in the air, and then the fact there are high cancer rates in those areas. We know that being put in poor communities in areas where there are factories and toxins will directly impact their health, which means they have less healthy bodies for their pregnancies. So it's all connected. We can connect environmental justice to maternal health, to economic access, to healthcare, to education, to all of those issues. And as a community, we must work together to educate us on all of these different subjects and ensure that environmental justice is the overarching theme of that, because it plays a direct impact on our lives and our ability to thrive economically, physically, emotionally, and mentally. And there's so many different factors that could have played an impact, not having the healthiest diet, not being able to bring my doula on in time, not being able to afford all the necessary services, even in a privileged role such as myself. And what it did was my story brought my advocacy and all the issues I was talking about maternal health to the forefront in the legislature. They get to see firsthand how African American women have such a harder time being able to deliver their babies or being able to survive the pregnancy process for themselves. I think it's important that we bring representation to those bodies that make laws around environmental justice and maternal health. And experiencing my own loss in front of my colleagues of my own son because of the impact of the environment and maternal health, I am able to give Tennesseans a real life view and be a real advocate and make real policy change, because I'm able to bring my personal story and what I've been through to the forefront. When I talk to women in communities that are more socioeconomic disadvantaged, they don't have access to basic information. They don't know anything about creating a healthy environment, having a healthy diet, what's healthy food. And so that is why I figured that we need environmental justice advocates that understand the connection to maternal health. And those are doulas. In the last decade, you've heard more around doulas because they can come in as your champions and really help these women who are more likely to be impacted have their information and resources they need to create a healthy environment for themselves, their pregnancy, and their incoming babies, and after that. And that is why I push legislation to officially recognize doulas as vital members of the healthcare team, because they are both our environmental activists and their maternal health activists who can come together and help us advocate in a real way. So why is they important is because oftentimes when we think about maternal health, we think about before, during the pregnancy, and right after, but we're not thinking about the health of children going forth. And in a state that claims to be pro-life, and that means being for life of all phases of life, not just having birth, we need to think about how we're creating safe environments for our children growing up while they're young. So if we create this statewide lead testing program, we create equity across the board, and our children, and especially children in impoverished communities, can grow up drinking clean water, which is going to create clean bodies. And down the line for women, it's going to make sure their bodies are healthier so they can have healthy pregnancies. Maternal health used to be a subject that many people didn't talk about. It was kind of a hush hush, especially in the South, where it's very taboo to talk about those issues. But you have women like me and champions and organizations and social media who are help leveraging our stories in order to further educate the community that we are in a healthcare crisis, that our healthcare crisis, the issues around maternal health, directly contribute to environmental issues and how our communities are not healthy and clean. And so if we are able to start connecting those issues and start using our personal stories to influence policy changes, you're going to see more.